My name is Kulmeet Kanlas and I'm a primary care physician. I am very sure that you might have heard by this time about new vaccination. This vaccination is against a respiratory syncytial virus. This RSV virus is very common and it is very debilitating in children, especially very young children and very elderly. It leads to low respiratory infection leading to multiple complications including respiratory failure and death. Most of us will get respiratory syncytial virus infections like a lingering cold, cough, runny nose, sore throat, generalized aches and pains, which last for quite some time. After a week or 2 weeks, this disease will disappear and you will start feeling better. The mode of transmission is through most of the time droplets which are created through coughing and sneezing, and these droplets enter into another human being through eyes, mouth and nose. Sometimes when we cough and sneeze, these droplets land off different objects like doorknobs, tables, anything which is on its way, and if you accidentally touch that and you could acquire this viral infection. Most of the time this kind of infection is self-limiting, but in infants and also in elderly it could be very deadly. Fortunately, there has been attempts to create vaccination against respiratory virus for a long time, but now the efforts have come to fruition. GlaxoSmithKline have created a vaccination which seems to be very effective. In all the trials about this vaccine, the primary goal was that if someone is vaccinated, how many people do not get RSV infection? And it was very protective in about 80 to 84% of the people who were vaccinated. But the magic really happened if the elderly who has been vaccinated and they have one or two chronic diseases like COPD, chronic respiratory failure, congestive heart failure, kidney disease, liver disease, diabetes, those individuals, it was highly protective, and it was noted that it was about 94% protective, which is very significant as compared to up till recently we did not had any kind of protection. In the studies which I reviewed, it was also noted that elderly the person is, there was more benefit. So now it comes to next topic, who is candidate for this vaccine? This vaccine is indicated so far only for anybody and everybody above the age of 60. It is not indicated less than 60. Now, what are the precautions we should take? If somebody has history of severe allergies, especially anaphylactic reactions in the past, we should be very careful. As in every vaccine, they say that if you are allergic to any of the component of the vaccine, you should avoid it. But I think this is counterintuitive. Without getting the vaccine, how would we know that we are allergic to one of those components? In my practice, anybody who has known history of previous allergies and especially anaphylactic reaction, I will avoid those individuals. Further, if you get vaccinated and you develop some reactions like hives, itching, and in severe reactions start wheezing, coughing, and pass out, you must call 911. This is a new vaccination. I'm pretty sure as we go along, we will acquire more and more data about its safety, and we will be able to produce and predict with better accuracy. But at this time, this is the precaution which has been recommended. Further, I have been asked whether it is safe in pregnant women. I think this does not apply, as this vaccination is indicated for anybody above the age of 60. So I do not believe we are at a risk of somebody getting this vaccination while they are pregnant. Further, what are the local or systemic reactions which could happen with this vaccination? This vaccination can give you little pain at the site of injection, and that was one of the most common side effects which has been reported. Otherwise, you could have mild aches and pains, little malaise, and in rare cases, you could have fever. But most of the time, it was very minor complications, and there was no documented proof that anybody ever has to discontinue or they were not given any vaccination because of these side effects. In one case, severe Guillain-Barré syndrome was reported, but that was 1 in 12,000 and the incidence is very, very low. Next, what kind of vaccine is this? This is a live attenuated vaccine like any other, most of the antiviral vaccines are. In this, certain component of the virus are removed and the particles which can stimulate our immune system are preserved, and once you are injected with this vaccine, your immune system produces antibodies so that once you get a real disease, there is no complications and you do not get systemic reactions. Further, I have been asked by many of my patients whether it will prevent hospitalization. I am very sure that because it will lead to prevent low respiratory infections, especially in high-risk population, including elderly people with chronic diseases, it will lead to a lot of hospitalization preventions. Further, just to understand how big RSV infection is, worldwide, we get about 30 million cases every year, leading to about 1 million hospitalization directly or indirectly, and there is about 17,000 deaths all over the world. This data could change from region to region. Certain places which are crowded and overpopulated countries will have worse data, but those are the places where accuracy of data is the issue, that the data is not reported properly and we cannot come up with proper interventions. In the United States, there are about 177,000 cases which are reported every year on an average, and there are about 14,000 deaths per year which are directly attributed to this thing. I think it is prudent, unless there is significant contraindication to this vaccine, we should continue to recommend this vaccination. Further, if you got vaccinated and you have some complications, you should call CDC hotline, or GlaxoSmithKline also have a hotline which you could report your side effects. Where I can get RSV vaccine? RSV vaccine is primarily available in one of the bigger pharmacies chain stores like Walmart, Walgreens, and CVS. Most of these pharmacies give vaccination on daily basis, and you do not require any prescription, and also most of the time you do not need any appointment. I hope you find this video useful, and please do not forget to subscribe our channel because it helps us to remain motivated so that we could continue to produce new content. Thank you very much.